The governor is about to announce a new modified stay-at-home order here in New Hampshire, a staggered stay-at-home order with a number of things beginning to open up throughout the month of May. We are expecting also the latest information about the numbers here in New Hampshire as we continue to fight the coronavirus. The most up-to-date numbers from the Department of Health will be coming out today as well. The governor has been working on this plan with the help of a lot of input from the task force that's been working to take in public opinion and comment about what should be best. Let's listen into the governor now.
Today. I think first we're going to start with a public health update from Dr. Chan. I'll turn it over to him.
Thank you, Governor, and good afternoon, everyone. Thank you for joining us. Let me run through some of the numbers we typically run through for our public health update. There are now more than 3.2 million cases of COVID-19 globally, including more than 1 million cases in the United States. In New Hampshire, we have tested a total of 24,349 people for COVID-19. And in the last couple of days specifically, we have tested on average about 1,200 people per day. Currently, there are about 159 people undergoing testing within our public health laboratory. We are announcing an additional 164 people who have tested positive for COVID-19. That brings the total in New Hampshire to 2,310. Of these individuals, 270, which is an additional 8 individuals from what we reported yesterday, have required hospitalization at some point in their illness. And unfortunately, there are 9 additional deaths related to COVID-19 that we are reporting today, bringing the total of people who have died from COVID-19 in New Hampshire to 81. All of these new people who have passed away from COVID-19 were associated with long-term care or nursing facilities. I think these numbers point to and reflect the difficulty that New Hampshire and many other states around the country are having in terms of controlling the transmission of COVID-19 once it gains a foothold in our close living and congregate living settings like long-term care and nursing facilities. So as you're going to hear in a little bit, even as we talk and plan about how to reopen different segments of society in the coming weeks, it still remains critically important for us to protect those who are most vulnerable in our communities. And specifically older adults and those with chronic medical conditions, which put them at increased risk of adverse complications from COVID-19, need to still remain at home as much as possible and only go out for the essentials. And we need to do our collective job in terms of helping these individuals, these populations, social distance so that we can protect them. Now, we are looking very closely at the numbers every single day. And as I've said in the past, our epidemic curve, which we publish on our website on a weekly basis, continues to show a plateau or a leveling off in the number of cases when graphed every day. The hospitalizations remain stable, and our healthcare system also remains stable and not close to surge capacity. And you'll see some more information about this in a little bit. While we test more, we are going to identify more cases, which I think is what you are seeing and hearing about the last week. But there are some promising signals in the data. There are early signs that the daily number of new hospitalizations may be starting to slow. The percentage of all of our confirmed cases that have required hospitalization at some point in their illness is slowly decreasing. We're down to below 12% of our confirmed COVID-19 cases have required hospitalization at some point in their illness. And the doubling time, which can be calculated probably most accurately by looking at our hospitalization data, the cumulative total number of hospitalizations, has been slowly prolonging throughout the course of the outbreak in New Hampshire. It used to be very early on in the course of the outbreak, 3 to 4 day doubling time, then it lengthened to 8 to 9 days. Currently, we're up around 4 weeks, or approximately 30 days in terms of a doubling time for COVID-19 based on our hospitalization data. And our deaths. Well, we have unfortunately had to report some higher numbers of deaths in the last week, including today. The number of COVID-19 related deaths in the community has been overall low. In the last 7 or 8 days, there have been a total of 30 people approximately who have died from COVID-19 that we have announced. And all of these individuals, except for one, have been associated with our congregate living settings. And I think this potentially highlights the decreasing transmission within our community, but it still highlights the ongoing work that we have to do to protect those in long-term care and nursing facilities, in congregate living settings, where these outbreaks are really devastating to the facilities, the individuals in the facilities, and the families involved in these unfortunate losses. So I'm going to turn things over to the governor in just a minute. But I want to just summarize by saying that our social distancing efforts have been having an effect. There is some early signals of decreasing community-level transmission, but we still encourage people to stay at home as much as possible, leaving only for essentials. We want people to, when they're out, still keep a safe distance of at least 6 feet from people at all times, practice good hand hygiene, and when in public places, especially if social distancing may be difficult, please wear at a minimum a cloth face covering to protect others from the possibility of asymptomatic or pre-symptomatic transmission. You will see this guidance incorporated into what is going to be talked about in a little bit around Stay-at-Home 2.0. I want to thank you all for your perseverance and for doing the hard work of helping to stop the spread of COVID-19. Thank you.
Great. Well, thank you, Dr. Chan. So today we're here to make a couple different announcements, but obviously the big one is really looking at what steps the state can take as we move forward, and we're going to have a bit of a presentation. Believe it or not, they gave me one of those remotes to control the slideshow. We'll see how well that goes. So the people in New Hampshire, as Dr. Chan alluded to, have taken this epidemic incredibly seriously, and we cannot thank them enough. Everyone has played a significant part in flattening the curve and slowing the spread of COVID-19. And unfortunately, while we are not through it yet, we know we still have a ways to go. Today we're here to announce our amended stay-at-home order, what we're calling Stay-at-Home 2.0, where we will flex out additional areas across the state, modify our existing order to give Granite Staters more flexibility in their daily lives. This modified stay-at-home order will be in effect through May 31st, 2020. We all know that you're healthier at home, and that obviously continues to be true, and will be true not just today or next week or next month, but as we move forward. And I think it's one of those benefits, if you will, of going through this crisis is the reminders of just good personal hygiene, staying at home, social and physical distancing. Some of these are terms, the social distancing, we didn't even really talk about what that was just a few months ago, and now it has become part of our everyday nomenclature. But we are also taking steps to reopen our economy in a smart, phased approach that's supported by facts, science, and data. Each of the decisions and the guidance documents that we discuss here today, they've been reviewed by Dr. Chan and the team at New Hampshire's Public Health Department, and obviously we thank them and all those folks behind the scenes for their tireless efforts, a lot of hours behind the scenes to make sure that what we do is safe, smart, and data-driven. So let's first take a look at what has informed our decisions. The state took some very early steps to mitigate COVID-19. Let's see if this is going to work. Hold on. My slide guy ain't working. Hold on. Is it on? Do I talk into it? Is this one of those classic, the batteries are out? So, wait, hold on. All right, I'm going to point to the back. I'll point to the back and they can do it for me. Wow, that looks terrible. You had to know this was going to happen, right? Everybody's waiting to see what the governor's going to do next. And this is called building anticipation. It's a political ploy. You get everyone hyped up as to what you're going to say in the next moment. Well, let's do this. So let's just talk in general while they get the presentation up and running. The first thing we're really going to look at is the data. Everything we did was data-driven. And let's remember that when we first went into having to make some very tough decisions in the state of New Hampshire, it was all done around the concept of making sure that our healthcare system, our hospital system, did not get overrun. We did not get overwhelmed. And we've been able to do that, I think, in a very successful way. We see in other parts of the country, and even to our neighbors to the south, Massachusetts in particular, where some of the numbers are pretty hefty in some of those hospitals and healthcare facilities, folks working at all hours and having to really constrain any other ancillary opportunities that those hospitals and healthcare facilities may have because the number of COVID patients coming into those facilities is so high. So to inform our decisions, we talk about flattening the curve, and that's what that's about. You flatten the curve to make sure that the number of folks going into any healthcare facility at any given time doesn't overwhelm it. We have to increase testing, and we've been able to do that. When we first got into this process, we only were doing maybe 200 to 300 tests per day. I think the last couple of days we've averaged over 1,200 tests a day. And allowing us to increase testing gives us the opportunity to be more responsive at a very granular level in terms of if there were an outbreak or community-based transmission. A very, very powerful tool, as a lot of us have heard, both locally and nationally. Also, we have what we call the hospital capacity. Again, making sure that not just the COVID patients that are potentially in the hospitals today, but there are other patients. Remember, we have folks that might have a heart attack or a stroke or some other very emergent situations, very serious, and they are using obviously a lot of those existing beds as well. So we want to make sure both the COVID patients and there is capacity for the emergent, and then making sure that if we are going to flex, and I think we can today announce some flexibility within the hospital system, we're going to do it in a way that, again, allows that capacity, and just in case there's another surge or a push on the system, we are going to have the flexibility to withstand any additional numbers of COVID patients. Contact tracing. Contact tracing in New Hampshire has been outstanding. We're one of the few states in the Northeast that really continued ours. Other states pulled away. We continued ours, and I really believe that's one of the most powerful tools that we've had at our resource to ensure that even though the numbers are so severe just south of us in Massachusetts, we contact trace every single individual. We find out where they were, who they might have come in contact with, go through a quarantine process. It's a lot of manpower. It's a lot of hours. Again, names and individuals you'll never know or see potentially, but they've really put a lot of hours in to make sure that we're quarantining individuals and making sure that we can trace back where the virus might have come from, and it's all part of the tools to mitigate the viral spread. And finally, PPE availability. So the availability that the state has and the opportunity the state is able to capture specifically around masks or gloves, gowns, whatever it might be. We've been very fortunate here in the state of New Hampshire compared to a lot of other states. Frankly, one of the most fortunate in the country. And our ability to do deals very, very quickly, bring them in. We had another huge flight yesterday. Just to take a little bit of an aside, the fact that we've been so successful, the Federal Veterans Administration is now using us to get masks. We brought in 4.4 million masks for veterans administrations and organizations all across the country because we've had such success in doing it right here. So we'll go to the next slide. So this slide here, and I'm going to look to my right just to make sure I got it right. There's a lot of data on this slide, but it's a very important slide for a couple reasons. So what this is showing in the bar graph, first you see the overall number of tests, and that's the height of each bar shows the number of tests we would be doing on any given day. The blue part of the graph on those bars at the very, very top indicates the positive cases that we received of the number of tests. The key component here is the orange line shows the trend of the increasing number of tests that we've been doing and averaging per day. So as you can see over the past 10 days or so, that line is going very much in an upward direction, showing our increased ability to test folks, to be responsive, not just in the long-term care facilities, but in communities as well. We've set up our 5 fixed locations, as well as all the locations, all the 11 convenient MD locations, the mobile units we have out there. Really a lot of opportunity out there for folks if they have symptoms, see their provider and get a test as needed. Very, very powerful tool. Now at the same time, if you look at the blue line, coming down around that same time when the orange line starts to peak up, you see the blue line, a general downward trend starting about 10 or 14 days ago, and that is the percent positive of COVID cases per number of cases that we do. So in other words, for any particular day, even though we might have a large number of positives, like today, we had over 160 positives today, but we're doing over 1,200 tests. So overall, we have a downward trend in the number of positive cases of COVID on a percentage basis across the state. That's a very, very powerful indicator that we're going in the right direction. And as you can see, that's exactly what you want to see. A downward trend of the number of positive COVID cases that correlates with an upward trend in the number of testing and the amount of testing that we're doing. Next slide. So this slide, it shows a very interesting slide and powerful slide in terms of hospital capacity. Again, we go back to that foundational concept that whatever we do, we wanted to make sure hospitals and hospital beds were going to be available if there was a large surge with COVID, or even if we could withstand another large surge as it comes. So what you're seeing here, the light blue, there's in each of these bar graphs that you see, there's actually a little sliver of dark blue at the very bottom. That's the number of COVID patients on any given day that is utilizing a hospital bed. The light blue is the number of general patients, the more emergent patients. Again, the heart attacks or strokes or folks that have more emergent care needs that had to be hospitalized over the past few weeks. And as you can see, the vast majority of people in hospitals right now are still those that required emergent care, non-COVID patients. And the orange line that cuts across the bottom, very steady at about 5%. That's the percentage of beds currently used by COVID patients. It's only about 5%. And the gap from the top of the bar graph all the way to that dotted line you see, those are available beds today. So we have approximately just shy of 4,000 beds in this state in total, and we're using less than half of them right now overall, with all the patients included, which is why we know we have a lot of flexibility in terms of flexing open what we can do with our healthcare system and our hospital system, and gives us a lot of confidence that, again, if there were another surge of COVID, if we do add additional surgeries or procedures, our system can handle the capacity that's going to be needed. And that's what was going all the way back to mid-March. That was the fundamental basis for making a lot of the tough decisions we had to in clamping down a lot of the economy, and the stay-at-home order was all about the healthcare system. This shows that we have capacity in that system to withstand whatever might be coming in the future. I'm going to bring Dr. Chan up to talk about these next two slides. Dr. Chan, do your best to kind of look to the right here to talk specifically about the inpatient on a daily basis.
Great, thank you. So this is a graph that is looking at the number of new patients hospitalized with COVID-19 by the date of admission. Now, what we end up reporting out on the website on a daily basis tends to be the day that someone is reported to us for being hospitalized. But this is looking specifically, graphing people hospitalized with COVID-19 by the date of their admission. And you can see that in the first half of the outbreak in New Hampshire, there was a general increase in the number of hospitalizations per day related to COVID-19. But in the last couple of weeks in particular, there's a general downtrend, and that's highlighted in the blue bars, which is showing the total number of cases, the total number of people, per day hospitalized by day with COVID-19. The orange line there is a 3-day moving average, which shows a general trend. It's meant to smooth out the curve a little bit, highlight the trend, the decreasing trend a little bit more. But this is some of the data that I was referring to, talking about there's some early signals that the number of people hospitalized on a daily basis with COVID-19 is beginning possibly to trend downwards. This obviously requires close monitoring. We're going to continue to monitor very closely what happens with the hospitalization numbers in combination with the other data. Next slide, please. And then I think this is maybe the last data slide, looking at the percentage of patients with COVID-19 associated with institutional settings, again graphed by the date. By the date, And you can see this is what I was highlighting, I think, earlier, that in general, the percentage of cases that are being reported to us, the percentage of people with COVID-19 is increasingly associated with our congregate living settings or long-term care, nursing facilities, and this is also highlighted in the death data I presented earlier. So I think there are some early signs of potentially decreasing community transmission, but we certainly have our work cut out for us in terms of trying to work with these congregate living settings to help protect the more vulnerable individuals in these settings, and then hand it back over to the governor.
Great. Thank you very much. That's that slide, as you see, that it constantly increasing, showing again the number of positive cases within those facilities. It's an unfortunate aspect of what we're dealing with, but it obviously indicates that the percentage of positive cases in more a general community setting is obviously going down. So let's jump to the next slide. So here let's talk about what we can do. So now that we've kind of analyzed the data, we've looked at all the different kind of data points, not just regionally within the state of New Hampshire. We've looked at it within the congregate living setting. Institutionally, we've looked at the trends, not just single data points, but making sure that we have trends. We've used the federal guidance coming out of the CDC, requesting that you look for trends on the order of 10 to 14 days at a time to make sure that, again, you're not just finding blips in your data, in your pieces, in your data points that are coming. So today we're really starting with issuing our universal guidelines for businesses that are currently open, and we're going to start there. The universal guidelines, and all the guidelines we talk about today can be found at nh.gov. And so you can go on to nh.gov for any of the areas that we're talking about, whether it be manufacturing, existing businesses that are currently open, or some of the new businesses that we think we can flex open. You can all get it all at nh.gov. But what we started by doing is using a task force, a bipartisan task force with legislators, stakeholders, in a bipartisan, or I should say nonpartisan way, allowing folks to come in and open in public meetings. Anybody could dial into them. At times we had 1,500 to 2,000 people dialing in to these meetings to hear the presentations of the various associations that might come in. Maybe the barbers or cosmetologists, manufacturing, restaurants. They all got to come in, talk about some of the impacts that their communities had been feeling, as well as some ideas. And that allowed us to put a lot of different ideas on the table for all these different business sectors, have them batted around, and then they could bring that and work in hand with the Department of Public Health and Dr. Chan and his team, and ultimately come up with what we're calling, again, Stay at Home 2.0. So there's a baseline set of universal guidelines that pretty much all businesses that are currently operating were asking to undertake. And these are some very simple guidelines and very simple things, very common things that many of us have taken on, still currently in the workplace, whether they're just good personal hygiene, physical separation of employees, using PPE or cloth face coverings when appropriate or necessary. And so again, that can be found at nh.gov. The next slide, I'm going to bring up Commissioner Shibinette really to talk about one of the first areas and opportunities that we have, which is with our hospitals. Commissioner.
Thank you. Next slide, please. So in early March, our healthcare partners moved quickly to defer all medical procedures and elective surgeries that were not considered urgent or emergent. They did this for a myriad of reasons, but not limited to conserving PPE and to prepare for the surge of respiratory illness. Due to the significant steps of our state and our healthcare partners, our health systems have been able to manage capacity thus far. We all know that COVID-19 will be with us for a long time, so being able to access needed healthcare services is paramount to keeping our communities healthy. As our healthcare partners moved through the past several months, the area between time-sensitive and urgent began to gray. As we know, the longer delay in a time-sensitive procedure or an elective surgery, the greater risk we take in having a negative outcome. For the past several weeks, the department and our hospital partners worked cohesively to create a plan to deliver time-sensitive healthcare to our citizens. Our plan that has many foundational guidelines around safety, PPE, social distancing, and patient flow to ensure safety for our citizens. If you look at the graph that's presented on the screen, you will see that our guiding principles are really focused around no activation of our crisis standards of care, which we have not done to date. Having distinct patient flow policies for COVID and non-COVID patients, both in the facility and upon entry into the facility. Clearly segregated patient areas for COVID and non-COVID patients, and for hospitals that can't accomplish this throughout, having a transfer agreement in place with a hospital that can segregate. Current limitations on visitors being maintained, and clearly articulated policies on social distancing for their staff, patients, and necessary visitors. Currently, we sit in the emergent, urgent part of this triangle, which is what we are doing now. When I talked earlier, I talked about the line between urgent and emergent and time-sensitive beginning to gray. As we all know, that when you have a time-sensitive procedure or surgery that needs to be done, the longer you wait, the more difficult it is, or the more it impacts the quality of life. So we felt it was very, very important that we officially work with the hospitals around developing safety guidelines so that we can start treating and doing the procedures that are time sensitive earlier to prevent negative outcomes. So as early as Monday, some hospital systems are prepared to start prioritizing patient procedures that are considered time sensitive, so in this block. Both the ability to provide the expanded service and the degree in which the services are provided is based on many factors, including supply of PPE, access to testing, access to skilled staff, and the overall state of COVID-19, how COVID-19 is impacting their region. This will look different in every facility. Every facility will scale up or scale down based on these factors with a laser focus on safety. Any New Hampshire resident that has a chronic health condition or needs a time-sensitive procedure should reach out to their provider. The healthcare system in New Hampshire has worked hard to make healthcare safer for everyone. I'm going to turn it back over to the governor.
Great. Thank you, Commissioner. So again, we see this as one of the most important areas that we can flex open a little bit. The idea that we, within our hospitals have some of these additional procedures, and then over time continue to grow that flexibility, assuming that we can still get some continually positive results with COVID. Another area that we've received a lot of questions on and concern on revolves around campgrounds, something that frankly I never thought would be such a hot topic in the state of New Hampshire. Again, there's guidance available at nh.gov, but some of the highlights are really that campgrounds are only going to be available to New Hampshire residents and members of the private campgrounds. So again, only New Hampshire residents and members, we are going to keep them open. Local towns may choose to close their public campgrounds if they so choose. And additional physical distancing restrictions within those campground sites. We have guidelines in there, certain things such as having essentially a 50% occupancy within any individual campground, limiting the number of individuals in any single party of a campground. We'll probably limit the number of services within that campground that would potentially entice communal interaction, maybe the stores and things of that nature. A lot of sanitization and cleaning of the bathrooms and restrooms and public facilities that are still required as part of those. But again, listening to both the campgrounds and members of the community, a lot of the individual cities and towns, making sure that we're addressing all of their concerns, and we feel very confident that the guidance going forward provides the health and safety that is required not just for the campers themselves, but for the communities that these campgrounds are in. Next, we have our parks. So again, seacoast beaches will remain closed. And as I've said repeatedly, unfortunately, beaches are going to be one of the hardest things for us to flex open, given the proximity to Massachusetts. And that tube of toothpaste analogy I use, where, again, if we were to flex our beaches open, undoubtedly you'd have a huge influx from very infected areas on the North Shore and around Massachusetts. So we're going to try our best to work in conjunction with our partners in Massachusetts and Maine, working on different ideas. Right now, the folks from Hampton Beach are working with folks from York and Ogunquit and Newburyport, all across this kind of northeast seaboard to try to get something, so we're all taking a step forward together. Luckily, it's still only May 1st. That gives us a little bit of time, but they are working diligently, putting in a lot of hours, working with our Open Up New Hampshire Task Force team, and hopefully create a lot of opportunity. But right now, the seacoast beaches and parks will remain closed. Interior state parks will remain open with adequate staffing. The staffing is a big part of the parks, especially when you look at the trail systems, making sure we're keeping our physical distancing. We see a lot of photos out there around certain parks, whether it's Mount Monadnock or Mount Major and some others around the state, where you see lots of cars in the parking lot or even up and down the roads. I think one of the misconceptions is that those cars are representing individuals lining up back to back, and they're really not. You could have a 500 people up on a mountain, but when they're spread over a 4 or 5 mile trail system, sure, you have people passing back and forth, but with the staffing there, reminding folks, the staffing on the state part at least, reminding folks to keep that physical distancing. We also have planes that'll sometimes go across the top of these mountains just to take photos to see how folks are congregating. And I got to tell you, they're doing a very, very good job. You have these small groups of individuals maintaining 6 or sometimes 10, 20, 50 feet apart, making sure that the physical distancing is there. They're being very responsible about it. And that gives us the confidence to go forward and allow these opportunities to remain open with staffing. And then obviously we have this amplified universal health and safety guidance that we're going to be providing for the interior state parks, and that's mostly for the employees in terms of what their requirements will be, whether it's handling of facilities within the parks, sanitation requirements within the parks. But the good news is that we can leave most of our parks open. We're going to staff up and put the new guidelines in to ensure public health and safety is paramount. Manufacturing. So manufacturing is an area that we never was always deemed essential, has always remained open. But we see across the country different manufacturing facilities depending on the size of the facility, the close-knit nature of individuals. We want to take extra precautions and be sure that we're creating new guidelines for our facilities here in New Hampshire to ensure we don't get some of the outbreaks that have been seen across the state. So it does remain an essential industry. It will remain working. You have manufacturers in New Hampshire that are doing an incredible job just changing what they're doing, changing their lines to create new products for us, whether it's PPE or other items that might be required for testing or whatever it is, creating new products for us to respond to the crisis, and we cannot thank them enough. But again, we'll be providing universal guidance to all of New Hampshire employers and employees to ensure the safety regardless of the size, type, and scope of those manufacturing operations. Golf, again, boy, I do not golf anymore, but a lot of people have been asking about golf. Very hot topic. I think at one point I got a petition with 8,500 people asking to open the golf courses. And again, not necessarily at the top on our priority list, but seeing what has been done in other states. We took some modeling from other states, worked with the Golfing Association as they came in. It is an outdoor activity. It does provide a lot of, some folks, it's their primary exercise, walking those 18 holes. And it is an activity that is very conducive to physical separation and physical distancing. So we wanted to take a look if it was possible. And it is. We are going to open up golf courses. We have specific guidelines to allow for the public and private courses to open. But again, participation, like the campgrounds, is going to be limited to New Hampshire residents and members of those courses. So again, we are opening our courses, but like many other states, we're limiting it to our residents only, and memberships, of course. And again, use of clubhouses, how we're dealing with food and beverage. We're not going to let people come in and treat the clubhouse as a traditional restaurant. Again, minimize that opportunity for coming in close contact with one another. The courses will be allowed to do some food and beverage, kind of pick up boxes or food and beverage on the course, again, allowing for that physical separation. Some examples of the guidance are, no congregating around. You basically go from your car to the first tee, you play, you come off the 18th hole, and you get back in your car and head home. We're not going to allow folks to do putting greens or pitching or driving or anything like that right now. But again, we've really worked hard on finding guidance that works, that we think doesn't just work in New Hampshire, but has been working in other states, and we feel confident going forward that we can provide that physical distancing and a safe and happy and healthy experience on the golf course. That one, just to back up a little bit, that is starting on May 11th. So again, up until this point, the campgrounds, the manufacturing, all those are already open. So technically, all these new guidance protocols go in immediately. Same with hospitals; they'll start some of their initial steps as early as this coming Monday. Golf is going to be on May 11th, so we're giving 1 week for the courses to staff up, to be prepared, and get ready with the new guidance that we've put into place. Also on May 11th. We're looking at the barbers and hair salons. So we had a great and very robust conversation with folks that represented all the different aspects of this industry. They're all very different. A lot of them are very small businesses and small shops, so we wanted to make sure we got as much of the input as we could. So some of the examples of the new guidance that we'll be putting into place would be we're going to allow folks to come in by reservation only with a limited number of open chairs. In any given facility, no more than 10 individuals, including staff, could be in a facility at one time. There's no congregating within the establishment, so you make your reservation. They either text or call you to come in at your given time. You cannot come in and use the traditional waiting areas. We're limiting the waiting areas as you traditionally have in one of these establishments. And one of the provisions that has to be adhered to is cloth face coverings have to be worn by both the employees and the customers. So that could present some challenges, we understand, but this is an area where we wanted to try hard to open up. It's an area of very close contact between two individuals, but we are requiring both the customer and employees to wear some type of cloth face mask and face covering as deemed by the Department of Public Health. But we think it's a good first start. It allows some folks to go in. The other aspect here is it's just really for cuts and very simple coloring. That's it. I don't know much about coloring hair. I don't know what to tell you, but cuts and limited coloring services will be available for now. That's really where we're limiting it to. But I think it's a good first start, and again, we'll keep looking at the data and the opportunities as we go forward to see how we can keep flexing some of these establishments opening a little further in the future. Also on May 11th, we'll be allowing expanded retail opportunities. So a lot of the retail stores in New Hampshire have already changed their models. They've gone to curbside pickup, online ordering over the phone. We are going to allow folks to come actually into the retail shops. We're limiting that to a 50% occupancy within interior locations of retail establishments. There it says PPE, but it's really what we're talking about is face and cloth coverings for all employees within those establishments. We highly recommend, and it is very much recommended, that patrons also wear face and cloth coverings, very similar to what we're doing now in our grocery stores and other facilities. But for employees, it is absolutely required. And we have a whole set of guidelines for strict sanitation, depending on what the retail outlet and the activity of the employee might be, the interaction with the customer. Obviously, we want to maintain a 6-foot distance between the customer and the employee at all times. But when that isn't possible, having proper hand sanitation, maybe gloves in certain instances, and of course a face covering for those employees will be required. But again, hopefully this allows us to take some first steps in a safe and smart way to get retail shops across our state moving again. Drive-in theaters, I think we have 1 or 2 in the state, last time I checked, but a lot of folks are looking to open them up, and frankly, there's something that is very conducive to good physical distancing. Most folks are simply in their car with their family, and the proximity to others in the general public is obviously naturally very limited. So we are going to allow theaters to open with proper social distancing. We have guidelines on food and beverage restrictions, so the food and beverage will be allowed, but again, we don't want folks congregating in a line or close proximity in a line. We're going to run the food and beverage out of these facilities, similar to what we're also advising into a golf course, something where it's kind of a grab and go type product where you're not sitting down or anything like that. And then we do have a lot of restrictions on congregation in bathrooms and other accommodations or communal areas. We don't want folks having to wait in long lines, so we're making sure that the owners and operators of the drive-in theaters provide appropriate ability for whether it's adding additional bathrooms or porta potties, whatever it is. We just want to make sure that those long lines that you can sometimes get in those facilities are not there, and they have to manage and mitigate to those requirements per the guidelines. We're giving another couple weeks, but we are going to try to flex open restaurants. Restaurants is obviously a very hot topic for a variety of issues. On May 18th, we are going to basically expand our takeout service to outdoor seating options. And again, we're giving a couple weeks for this to gear up for staffing, ordering of food, product, preparation. We're asking for a lot of flexibility for a lot of cities and towns to allow for expanded outdoor seating options for venues that traditionally might not have current outdoor seating or may have limited outdoor seating. We're hoping that they have the ability to expand smart and safe. We're insisting that tables have to be at least 6 feet apart. We're limiting the number of individuals at any single table to 6. Servers have to wear proper face coverings, cloth face coverings. And again, we have a whole set of guidelines that we worked very closely with the New Hampshire Restaurant and Lodging Association to develop, along with the Department of Public Health. Everything from some of the basic food safety guidelines that you'd have in the back of the kitchen to the handling of food as it comes out. It has to be handled a little bit differently in an outdoor seating situation. But again, we want to expand it. We want to flex it out. We're just not at the point where we're comfortable allowing the indoor seating just yet, but that's probably a next step, hopefully in the near future. We'll see how these initial steps go. One of the challenges with restaurants right now really is our friends just to the south in Massachusetts. It's not about blaming Massachusetts, but the reality is the 2 most northeastern counties of that state have the highest impact of COVID. And those are bordering counties just over the border from Nashua, Salem, Hampton. And restaurants are a very enticing opportunity for folks from Massachusetts to come out. So we're not restricting people only in New Hampshire to be there, but by allowing the outdoor seating, the fresh air, and limiting the number of people that can be in a party and the close congregation that you typically have in a restaurant, we think it's a safe and smart first step to allow a few more facilities to open up. And again, for all of these businesses and opportunities we're talking about today. No one has to open up. We're not mandating that anybody open. We understand that a lot of businesses may still not feel comfortable. Businesses may, depending on their setup, may have a hard time adhering to certain guideline provisions, and we can appreciate that, but the provisions have to be upheld for all of these different areas. But again, we're just trying to allow those who can open under these new guidelines to open and take those first steps of flexing out of the pandemic crisis that we have here in the state. So what you're seeing before you now is just a brief kind of a timeline, just a bit of a summary, if you will. So immediately we're looking at campgrounds, manufacturing, and our interior parks, which are currently open but now have to operate under our new universal guidelines. Hospitals with time-sensitive care services, whether they be a knee operation or a hip operation, maybe an MRI or a CT scan that has had to be postponed, biopsies, there are biopsies that have had to be postponed. A lot of those types of services may now be available if the hospitals so choose to move forward immediately, or really as of Monday, May 4th is where we're going with that. Golf, retail, drive-in theaters, barbers and hair salons on about a week later, on Monday, May 11th, they can start those operations. And then on May 18th, again, giving a couple weeks for the restaurants to gear up on both product and staffing, and maybe the additional accommodations that would have to be made for outdoor seating will start again on May 18th with restaurants. So again, I got to give a lot of credit, if I may, to the folks at the Reopen New Hampshire Task Force. They have been just doing some incredible work on all these different areas, and they're going to continue working. We have a lot of other areas. Maybe it's a bowling alley or an arcade or hotels, other tourism destinations, things that we would ultimately very much like to see up and running. They're huge parts of New Hampshire's economy that are still very much impacted by the COVID crisis. And again, that task force will still have their open and public meetings, a lot of the presentations coming in, working with public health to try to make sure that we can truly take those next steps. As a reminder, you can see all of the new guidelines and guidance documents at nh.gov. They'll be also ultimately distributed across other parts of the websites at the state level in a variety of different areas. But today, we're starting with nh.gov, so there's a singular point. People can go in, see the facility or the type of industry that they're looking at and the type of industry we're flexing open, and start those business owners and managers can start looking at those guidance documents and seeing how best that they can fit in and try to make it work for them and get folks back to work, get our economy back moving again in a stepwise process. We're not taking giant leaps forward. We're just not at that point, but we do want to provide the opportunity to flex some of these things open, and we think it's a great first step. We're going to continue to look at data, continue to look at those graphs and charts that I showed you earlier. That's what we look at, not just day to day, but sometimes hour to hour as the data comes in terms of where we are, trying to get a handle on the situation, increase that testing capacity, make more PPE and face coverings available for folks. And as we do that, as we keep growing as successfully as we have, I have no doubt that we can continue taking steps forward and maybe, who knows, stay-at-home 2.0 becomes stay-at-home 3.0. We'll see what those next steps are. But we are creating steps. We can step forward, we can step backward, we can step forward quickly, we can step forward slowly. We've really given ourselves and trying to design a system to be as flexible as possible for the health and safety of our state and balancing the economic needs for a lot of our communities. With that, I think we'll open it up for questions. I appreciate everyone bearing with the long presentation.
Can we hear from Dr. Chan from the medical perspective on some of these plans, and what level of increase in viral spread we could reasonably expect from the increased level of activity?
The question is, what level of increase in viral spread can we see from these activities? And I think that's largely a question that there's not an exact answer for. It's an excellent question, and that's part of the reason why what you have seen come out both at a national level as well as local level around different states is this phased approach to opening. With any steps, we're going to be very closely monitoring the data in between different phases of opening. It could be 2, possibly up to 3 weeks before we would see an increase if one was going to happen. So I think that the general principle here is that the ability of this virus to spread person to person, because that's how it's primarily transmitted, is through respiratory droplets, person to person. It depends largely on people's ability to social distance when out, to wear cloth face masks when in public settings and social distancing may be difficult, to practice good hand hygiene. Right? There's a lot of factors that go into the ability of this virus to spread, and it's difficult to predict, but we are going to very closely monitor the data, the number of people that are testing positive, the percentage of tests that are positive, the hospitalizations, some of the mortality, fatality data, and the outbreaks certainly. And this will help inform what we do going forward, I believe.
Governor, you're a Constitution guy, and we've said...
Aren't we all Constitution people?
Yeah.
I should hope. This is America.
The last couple of months, we've heard you say, if a facility is public, you can't limit it just by the license plate. There's something called the Commerce Clause. So could you talk a little bit about
Yeah, we looked into that, and again, we're following a lot of the guidelines, not that we've discovered are available here in New Hampshire, but also other states as well. So we're taking a similar approach to other states and feel confident that, that again, the limitation with campgrounds and golf in particular to our New Hampshire residents is exactly what we can and should be doing.
How is that going to be enforced? For instance, a campground, is it just license plates? Is it like...
It's really up to the facility to make sure that they're adhering to the rules of the guidelines. So, again, we don't have stay-at-home police that patrol the state per se, but again, we trust that a lot of these guidelines were created by the campgrounds or created by the golf association, so it is very much in their interest to adhere to their own guidelines that they help us create.
But are the campground owners liable then if they do let out-of-state visitors, and who enforces that?
Well, my sense is if you had a large number of complaints, if there were a lot of out-of-state visitors potentially, it's probably something we could go and talk to them about and find out what the situation might be. Remember, out-of-state visitors, if you're a member, right, if you're a member that is living there full-time, and a lot of folks live at campgrounds for weeks or even months on end, that is allowed per this. So if you're a member of a campground, it's okay. What we're really trying to minimize is that weekend traveler up here, or just the nighttime traveler out of Massachusetts that comes up to New Hampshire and then back to Massachusetts and back and forth. That's what we're trying to minimize. So it's either folks that are here for good or our residents that are currently in place.
The guidelines of the reopening task force, which said that in order to flex the system, there need to be, 14 days worth of sustained reduction in cases. Has that happened?
Yeah, so that would be the blue line in the graph that we showed earlier. So about 2 weeks ago, we had kind of a peak of the percent case positive. You can do it in total or percent per the federal guidelines. And if you look at there's been a general downward trend for the last 2 weeks. Obviously, you're going to have bumps here and there, but it's been a pretty substantial drop-off in the past 2 weeks in terms of the percent positive cases that we average over we do a 3-day rolling average between 2 weeks ago from now. So we have that downward trend.
Dr. Chan described it as a plateauing, a leveling. Hospitalization may be starting to slow is his language. So so you're saying it's a sustained reduction?
Yeah, if you look at, if you go back to the presentation, you could look at the blue line starting about 2 weeks ago. That's the percent positive cases of COVID. We'll go back to it here. No, keep going. There we go. So back here, starting about here, coming down. So this is about a 2-week downward trend. Now once you kind of hit this bottoming type level, you're going to bounce around. And obviously, as we drastically increased testing, specifically around the long-term care facilities, which we know we've been really focusing on over the past week or so, we know there's going to be kind of this bump up, bump down in terms of numbers. But overall, the percent positive from 2 weeks ago today is pretty severely down.
Shouldn't the metric be how many cases are every day? Because the percentage is totally influenced by how much testing you're doing. So that blue line goes down as the orange line goes up.
No, just the opposite. So a percentage kind of normalizes. If I do 5 tests a day or 500, if I get 1 out of 5, or I could get, 100 out of 500 or 1 out of 5 and still have the exact same percentage. So in other words, some of those smaller days, if you go back 2 weeks where we were only doing a few hundred tests a day, if you look at the total amount of tests, look at today. We had the highest number of total cases that came in any given day, but we're still only at about 12% positive for the day because we did so many other negatives. So that's that ratio that we're looking for on a daily basis, and we want to make sure that consistently over time that number is going down or staying low over a 2-week period.
Describe how you would like the people of New Hampshire to approach this. The stay-at-home extends until May 31st, but they're going to have these options in terms of commerce and being able to go out and do things. So how should they approach this with retail opening up with
So the stay-at-home order is still in place. Let's be very, very careful. All we've really amended and augmented is the ability for some of these other aspects of our economy to open up, so people can come out and obviously go to the retail stores if they need to, go shopping or exercise or do what they have to do. But all the other aspects of the stay-at-home order are still in place. We're just starting to flex open the economy, if you will, and that's the amendment we're really adding on and why we're calling it Stay-at-Home 2.0. But you are healthier at home. We want people to maintain that physical distancing. And in all the aspects that we're flexing here, going to the earlier question in terms of, will this, what effect will this have? If you follow all the rules, if the rules are followed by the employees, if the rules are followed by the customers themselves, any sort of increase will be minimized in terms of, and I think allow the process to continue. My one fear in all of this is that people break the rules, that people don't adhere to the guidelines, that you do have folks that say, well, we're out of the stay-at-home order. We are not. We are not. I mean, ground zero for the COVID epidemic in America right now is 1 mile south of our border. That is real. That is very real. And so again, we can take some steps in certain parts of our economy, but that stay-at-home order really still is in place, and we want people to adhere to it.
So wouldn't you benefit from some enforcement, though, even in the southern tier? Pelham, Salem, any of these towns that could see some crossover for businesses opening up.
Well, I mean, remember, most of the businesses, our businesses haven't been all shut down. Right, the vast majority of business in the state has still continued on through this whole process. So, and we haven't need to enforce certain things here and there. This is all very easily manageable by a lot of these industries. I mean, just flexing and allowing outdoor seating, right, by a restaurant. Obviously, we're going to know if a restaurant ignores that and people start going inside, and we can work with them to try to make sure they're adhering to the rules. None of these are so draconian or so wide open of differences that it isn't very easily worked out. But again, I'm not one to harp on the enforcement, because we've tried to make it really easy for folks to follow the rules, real easy for folks to say, yeah, we're getting to flex open a little bit. We're getting to hire some people back. We do see kind of that light at the end of the tunnel. I don't know how far down that tunnel we're really from, but we want people to see that, and we've tried to make it easy for them. And we're taking the guidance as administered and recommended by their own associations. We haven't just made this up on their own. We used their words and their recommendations and made sure it fit with what public health was looking for to ensure that we can keep mitigating the viral spread.
Going back to the cases, so you have given some hard dates, obviously presented them here. Are those dates subject to change as more data comes out? Would you move them back if you had to? And how does Massachusetts cases, second part of my question, factor in?
Yeah.
Is the May 18th date, is that flexible if Massachusetts continue to see a surge?
I'll say this, everything is flexible. I mean, that's what we've really tried to do here. I never want to put my feet in concrete on anything with such an unknown, right? Every day we walk through this crisis, it is another step into the unknown. So we're trying to, again, use data, show folks the data and the science behind what we're doing and why we think we can do it safely and soundly, and make sure that we're adhering to that. So the data out of Massachusetts is very real. We'll continue to watch that. I'll continue to work with Governor Baker. I've always said I think he's doing a very good job in such a very, very difficult situation. Luckily for Massachusetts, they have a very robust healthcare system, right? They have a very robust hospital system, and thank God they can handle a lot of what's coming at them. But it's quite severe and very similar to what we're seeing here, just at a much more exasperated rate. I think they have something on the order of 30 times as many positive cases as we do right now, with about 5 times our population, 5 or 6 times our population. So it's very serious down there, and I think they're handling it as best as they can. But knowing their data points and working with them on a continual level is going to be very important. Same with Maine and Vermont. I think in many ways what we're doing is probably more attached to Maine and Vermont because we're more tourism-driven states. I think the impact to our unemployment is more consistent amongst the three of us as opposed to Massachusetts. I mean, we're all relatively the same because we're the Northeast, but Massachusetts is a very different economic dynamic, of course.
Of course, not everything is included in this
Sure.
phase one, if you will, athletic clubs, churches, what have you. For them, would they be part of phase 2, or how should they kind of think of you?
Potentially. So the question is about athletic clubs and churches and things of that nature. So it's all on the table, and we'll have them all be able to come in and talk to the task force and talk about some of their dynamics. Two things. I want to talk about the task force for a minute. I have been given a note that I guess this presentation is so popular that NH.gov got overwhelmed and crashed, nh.gov. So we also have our web, nheconomy.com. You can find the guidance documents also on nheconomy.com /COVID-19. So nheconomy.com /COVID-19 for those who are eagerly looking for those guidance documents. Going back to the task force and what we may do next, I don't know what we may do next. We're going to really listen to the data. We're going to listen to the task force. We're going to listen to the recommendations and work with public health. Without highlighting anyone individually, I can tell you there are business sectors in both the public and private sector that have come to us and said, don't open us. Don't open us up because we don't know if we could control the crowds. We know we'll get a run on the system and we don't want to have to turn people away. So we've had folks say, please walk cautiously with us. They don't want to be too far ahead of things. And we very much respect that. I think that's a very smart move on a lot of their parts. So people are being very responsible about it. And again, it's that kind of attitude that gives us confidence that we can work with people. It's not like there's an overwhelmingly push saying, you have to open us up, you have to open us up. Not at all. There's a small segment of that, of course, but I think a lot of folks that are looking at how their businesses interact with customers, how their nonprofits, their areas of worship or their congregations, sometimes those are in close-knit situations. I mean, if you were open up a church, let's say, a business we can say 50% occupancy, and after that you got to turn people away. How do you turn people away at a church? Right? And I think they understand that could be a very difficult situation. And so there's situations like that. We want to work with them and find that path, but it's going to be very difficult before we just open the doors, so to say, and let it all come forward.
Restaurants. So this open air approach and sort of patio, sidewalk approach, have you talked to restaurants? How viable is that actually as a business model? Because they're operating already on very low profit margins, even in non-pandemic times. Have you heard from restaurants who say, yes, we could make that work?
Yes.
Yes, we could hire back our staff and actually have...
Absolutely. So, look, as someone who used to own and run restaurants themselves, I understand that every restaurant business model is different. We've had some restaurants come and say, unless I can fill 75% of my seats, it's not even going to work for us, right? So don't even try. Others are smaller establishments that have the available space and that could seat almost just as many people outside. Maybe they have a big parking lot. So, they have the access to do it, so they could fit just as many people. It could be a much smaller establishment, but they have the availability to do it. We heard from some diners that are very excited to open, but they said, we're really only open in the morning and it's still 35 degrees sometimes at 7 a.m., so probably doesn't work for us now, but we might take advantage of it down the road. So everyone has to decide whether it works for them. We're not forcing anyone to open by any means. We're just providing the opportunity if it fits. And again, if it works and we can take further steps down the road, obviously we intend to do so.
Much like the golf courses, the campgrounds, the hair salons they've dominated the comment period that the task force has held. Almost 5,000 cosmetologists have signed a petition saying don't open now. We don't want to be in phase 1. We can't maintain social distance. We're touching people.
Yeah.
Could you respond a little bit to that?
Sure, yeah. So the idea that we had 4,000 or 5,000 cosmetologists come forward and say, don't open us, right? That was a great example. Again, we're not just opening them up wide open, right? So if they want to open, they can, and by no means does anybody have to. So I'm not forcing anybody open, but we're just doing cuts and limited coloring, right? Just start. We're not doing facials or all that other stuff. I apologize. I don't know all the details, but I know there's a lot of other processes that go forth in salons and things of that nature. But we're not doing any of that right now. So we're hopefully maybe allowing some of those folks that might have said, don't open us, and maybe they're coming back and saying, well, yeah, we could just do cuts and some basic coloring. That would be okay. We feel comfortable doing that. And we have our face coverings. It's been vetted by public health. We can help them provide gloves and some of the basic things they may need to do those basic services. So again, we're not forcing anybody open, but if the option is there, if the guidance fits their business model and they feel comfortable opening.
How's the PPE going to get to the businesses?
Yeah, so we have a couple different options to do that. So if businesses are looking for PPE, we can absolutely provide it. Again, the first level PPE we're recommending are cloth face coverings. I think that's right. I'm looking to Dr. Chan to make sure I'm getting that right. But cloth face coverings, again, in the case of a barber or salon, for both the customer and the employee. Are we using the DMV? Is that? I just want to make sure. I'm kind of looking to make sure I'm getting that right. So the DMVs are going to be used. I think there's about four. How many do we have around the state? About 14. I think I have that right. I'm doing that off of memory, but I think we have about 14 DMVs across the state, and they'll be one of the outlets that we're using just because they're so easily spread across the state. So yeah.
I want to ask about unemployment. So weeks ago, you expanded New Hampshire's unemployment to include people who are affected by COVID-19. With businesses reopening and looking to hire back workers, you're going to have workers who are on unemployment right now who were laid off, who are now kind of having to choose whether to go back to work or potentially lose their unemployment benefits. For workers who are at risk, at higher risk of contracting the disease, or of suffering from it, are they going to still be able to collect unemployment, or what would be their situation? Okay.
Yeah, right now we're not changing the rules around unemployment, and if a worker wants to remain in their unemployment phase because there's a health risk to them, that they can remain doing that.
Can we learn a little bit more about the people who died in the congregate living situations?
Dr. Chan or Lori?
I don't. The question is, can we learn more about the people that died? I don't have much more information. Okay, I'm gonna let the commissioner speak to it.
New deaths announced today in long-term care facility, one at Aurora Assisted Living in Derry, one at Birch Hill, one at Crestwood Center, Milford, two at Hanover Hill in Manchester, one at Mountain Ridge in Franklin, and one at Salem Woods.
I was just looking for a little bit more clarity on, you were on air this morning, Commissioner, and you indicated that there is, maybe we misunderstood, but is there an effort to test at every home?
Every home that has symptoms. So what we don't want to do is go into a home that has absolutely no symptoms at all in staff or residents and introduce new people into that environment. That's exactly what we're trying to avoid. So what our goal has been, so that's in the facility. So obviously in Rockingham and Hillsborough County, we're not going into the facility to test the healthcare workers. The healthcare workers are going to a mobile site. So that we are doing. Hillsborough, Rockingham, we're expanding that to Stratford and Merrimack starting next week. So you're going to see large groups of healthcare employees being tested, but we're not going to go in and test residents when there is no evidence of COVID in that facility at all, because you're introducing new people into that environment.
That was the opinion. I mean, other states are doing that. Like, you think it's a bad idea?
Right now, based on what we currently know, I mean, everything that we've done around long-term care has evolved in the last 2 months. And, what our initial guidance 2 months ago was to only test people that were symptomatic. And we did that for about a week and said, no, this is not going to work. We need to test all the residents and we need to test all the staff when there's symptoms. Now, a week from now or 2 weeks from now, if testing supplies open up and we're able to dispatch number of teams and we think it's warranted, we may change that risk-benefit analysis as we know more about the virus. I think what we are learning, every state is a little different about how COVID-19 is playing out. When you look at states like New York, where you have this widespread community transmission and thousands of people, going into the healthcare system, that looks different than how it's playing out in New Hampshire right now. In New Hampshire right now, we're not seeing that surge in our hospitals, but what we're seeing is that this is largely playing out in our congregate settings. We have people on all of our teams at DHHS. We have a testing team. We have PPE teams whose main focus is just to take care of long-term care facilities. Starting next week, I think we need to do more focal discussion and strategy around how we can support them better, probably with staffing. We've used our Medical Reserve Corps. We've used a host of volunteers, furloughed staff, tons of programs, getting nursing students certified as LNAs to get more staffing into the facilities. But as this COVID-19 crisis continues to evolve, it is becoming very apparent where it's hitting the most, and that is in our congregate settings.
I mean, is it a question of the lack of supplies? I mean, it would seem to me that maybe once symptoms exist, it might be hard to contain a potential spread, with the caveat, like a sore throat and a cough is probably a pretty common occurrence, so how do you judge?
Well, we know that the residents aren't bringing it into the facility, right? Because the residents aren't leaving, and the new admissions into the facility need to have 2 negative tests before they get there. So we know that we don't have visitation right now, so the best line of defense is the staff. And that's where we've focused our resources, is testing all the staff, and we're moving through the state to do that. And we've actually gone back to facilities and we've retested several times some facilities for even the people that tested positive 3 weeks ago. We've gone back a week later and retested them all again. And we continue to do that in some of our outbreak facilities to manage it as aggressively as we can.
Governor, I know you get asked this when you go to the supermarket. I mean, when will New Hampshire return to normal?
I don't get asked anything at the supermarket because I'm wearing a mask. No one knows it's me. When will New Hampshire return to normal? Normal being what it looked like back, let's say, March 1st or something like that. A long time. It's going to be a long time. I mean, you find me any model where it doesn't look normal. Look, we could open up the entire, I could say, you know what, we're just going to throw all caution to the wind and we're going to open everything up, no more stay-at-home order, nothing. Guess what? A lot of businesses still aren't going to open up. A lot of things are still going to be problematic. And then you'll have also the viral spread. You'll have a run on the healthcare system. None of that would look normal, right? So unfortunately, my sense is either we get to a point where we can really manage long-term with new guidance and new ways of maintaining physical distancing, expanding our ability to keep all these businesses up and running and getting everything, if you want to look at the metric of unemployment, back to something, more not in the 14%, but back in the 3 or 4% range. But even then, I don't think it's going to be normal until maybe we get to a vaccine level. Your guess is as good as mine on that, right? I think as citizens, this is such an unknown. We just don't know. Now, we heard some good news today. It looks like one of our partner right here in New Hampshire, Lonza, it's been announced that they do have a partnership with a group that is right on the cutting edge of a vaccine, and that's very exciting. I talked to some of the folks higher up in Lonza, and I said, whatever they need, right, financially, regulatorily, whatever they need, whatever doors we can open, we're just very proud to have an organization like that in our state that is trying their best, putting everything they got behind a potential vaccine. But that could be months away, it could be years away. You just don't know, unfortunately. Do we have some folks on the phone that want to ask some questions? Thank you very much.
Our first question comes from Holly Raymer with Associated Press. Holly, go ahead with your question.
Hi. It was hard to hear. I think Ethan touched on part of this question, but the scenario that came up a lot with the hair salon owners and workers was if the hair salon owner decides not to reopen because they don't think it's safe, can that owner and their workers still file for unemployment? Or if they do reopen, but because of their restrictions on capacity, a worker has reduced hours, and they still apply for unemployment benefits?
Sure. So the question is around unemployment benefits for any of these businesses who choose not to open. Yes, absolutely. They can still apply for. That's part of the expanded unemployment program that we set out. We're one of, I think, if not the first state to do that and to create that opportunity for individuals, knowing that there were going to be a lot of difficulties within the system. So yes, those folks can all apply and obtain unemployment benefits under the new guidelines.
The next question comes from Paula Tracy with In Depth. Paula, go ahead with your question.
Yes, good afternoon. I have a question related to what just Holly was asking you about the cosmetologists. Would they be able to limit the customers to New Hampshire only? And then I have another question for you, which you don't have to answer right now, but you could think about it. You ventured in 2009 off 5 months in the woods and hiked the Appalachian Trail. You must have learned some things about patience and how to get through things that you might provide as advice to the citizens. Just wanted to give you that opportunity.
Wow. Okay. Well, the first question revolves around whether other businesses not highlighted in the guidance could be allowed to refuse service. Look, a private business can refuse service to anyone, technically. Assuming they're not part of a minority class or some, not breaking any sort of traditional employment rules, of course. But if under if someone were to walk in from Massachusetts, technically they could be refused service because they're a private business simply being from Massachusetts. It's not part of a protected class, I think is the appropriate term. The second half of the question revolves around my hike on the Appalachian Trail back in 1998. Anything I've learned there? Wow, that's an interesting question. I learned a lot walking from Maine to Georgia in the woods for 5 months. One is know your priorities and know your limitations and be patient. Every step matters, and sometimes it takes a long time to get where you're going, but if you start sprinting, you're never going to get there, right? It's a marathon. It really is, and this is a marathon with a bit of an unknown end. So we have to be cautious about how we go. We can't just sprint forward. It'd be incredibly irresponsible to do that. You gotta know your limitations in terms of what you can and cannot do, can and cannot expect. Know the limitations of the team. You can't set expectations so high that they can't be met. If you set your expectations high, then you're always going to be coming in under. And in such an unknown situation, when a lot of decisions, I appreciate, fall on the shoulders of the governor here and in other states. I think going back, one of the reasons we talk so much, one of the reasons we do these press conferences, one of the reasons we go to such lengths showing all this data is because transparency is the foundation of public trust. And we want folks to know that, what we know, they know. And they're part of that process, and allowing, whether it's the task force to be open in public so people can listen in, or the Gopher committee, and making sure politics isn't in it, making sure it's all open and transparent. These are all the most important foundations of all the decisions that we're making, because we are all in this together. This is not just us driving a boat and hoping everyone gets on board. We are truly all in this together, so getting that input. And I know that seems like a long extraneous answer out of the how that relates to the Appalachian Trail, but it all comes down to knowing your limitations, appreciating what needs to be prioritized. I mean, on the Appalachian Trail, I had to know where to get a glass of water every day, and that became everything in terms of being able to make it to the next day. But knowing that and having a team around you that not just you can work with, but a team that you can empower, really surrounding yourself with the best and the brightest, and letting them do what they do best. That's a very powerful thing, not just for myself, but I think for the 1.35 million people in this state.
The next question comes from Matt Layton with NBC5. Matt, go ahead with your question.
Yeah, Governor, I was wondering if you could just kind of talk further about, you mentioned it earlier, about working with Maine and Vermont. It seems that the reopening of the economy is of an original approach. So I'm wondering how the decisions that were made for slowly starting to reopen New Hampshire's economy, how you discussed that with Vermont Governor Phil Scott as well as Maine Governor Janet Mills, and even if you had a discussion with Charlie Baker in Massachusetts.
Yeah, I mean, all the governors, we've been sharing ideas, both on terms of timing. I would, like, for example, we were texting back and forth yesterday, I think it was, where we were just saying, hey, look, I think I'm going to make an announcement at the end of the week. Janet Mills in Maine made an announcement earlier in the week. We talk about the concepts that we're going forward with, whether it be opening up opportunities for hospitals or golf or campgrounds, whatever it might be. Some of the ideas of the challenges that we're facing in other areas that weren't even discussed today, like hotels or other areas of tourism. So we're just constantly just batting around ideas, and if good opportunities come, we're all in this together as well. Governor Baker I talk to on a fairly regular basis, just a very different situation down there, of course. So he's more dealing with still trying to mitigate the spread in any way he can. Unfortunately, the numbers there are so different that they're not unfortunately where we are in terms of the ability to flex some things open. But we constantly work with him. We have a phone call a couple times a week with Governor Baker and all the other governors. I'm talking to governors all across the country. Governor Ducey in Arizona, Governor Burgum in North Dakota, Governor Abbott in Texas. We get on calls all the time and just what are you seeing there? How did you deal with this? What do you think of the unemployment issue? What are the incentives to getting folks back to work? What can be flexed open first? How are you dealing with the federal government? All of it's on the table with the governors, because through this crisis across the country, governors are the ones that have to operationalize and manage this crisis. We know the 50 governors in this country, and those that are also in the territories as well. We're the ones that are on the front lines of management. The federal government provides some resources and guidance, and that's all very important. And we work with them to get some PPE and the testing materials, because there's a bit of a funnel there. But making sure that a service is rendered or an opportunity is rendered for this individual or that family or that business or that school, that's on us. That's 100% on us, and you can't do it alone. So being able to talk to their teams and having our teams talk to theirs, our Department of Public Health, we'll talk to Vermont's Department of Public Health, let's say, and bat around ideas. Our Commissioner of Corrections might be talking to their commissioners of corrections in terms of, how they would mitigate their plans to mitigate any potential spread in their jails or their prisons, whatever it might be. So it's a great team effort. It really is. And this has been a time over the past couple of months where everyone's come together, at least on the governor's side, put politics aside and just said, we're all in this together. All our doors and our phones are open to each other. And it's been incredibly collaborative and incredibly, I think, beneficial, not just here in New Hampshire, but across the country.
The next question comes from Rick Juergens with the Valley News. Rick, go ahead with your question.
Yes, staying with the theme of corrections, the presentation emphasized that congregate living facilities have been continue to be a source of concern. In New Hampshire, only 11 inmates out of 2,366 have been tested so far. In Vermont, they've had a pretty big. They haven't been as skilled or as lucky in keeping COVID out of the prisons. My question is, at what point would it make sense to aim to do universal testing of the prisoners in the prisons and jails, or alternatively to do universal testing of the staff going in and out of the jails?
Sure. So the question really revolves around universal testing within our prison system for both the employees as well as the workers. We've been very fortunate, and I think the term you used was both skilled and lucky, frankly. We just have had a very low rate of COVID in any of our systems. We know that could grow exponentially at any given moment, given some of these facilities. Remember that the jails and the prisons are naturally set up to be very segregated. Obviously, folks are in their cells, so there are a lot of physical barriers already in place. And again, if there are anyone with symptoms, if there's anyone that's suspected that could possibly be that could have COVID, of course, we go in and we test. The testing is absolutely available to all of these facilities at any time that it's required. We've just been in a very fortunate situation. If we suspect that something could be outbreaking, of course, we'll be there to do the testing. In terms of just going in and blanketly testing everybody across the board, we're probably not there yet, just because the need isn't really there, and we're trying to focus our testing capacity not just on those who have symptoms in the general public, but also those long-term care facilities that are at the highest of risk. Right now, we're fortunate that the jails and the prisons are not in that situation, but if it were to come to that, we could react very, very quickly, right? We have a lot of testing capacity we can mobilize. It's not just fixed in one location. We can mobilize some of these mobile units very quickly if we have to. Okay, I think that does it for any more questions. Oh, sure.
So it would seem that with more facilities open, more chances for community transmission, there would also need to be an increase in contact tracing for any cases we do get as these facilities reopen. What is the state's plan? Are we beefing that up in the Department of Health and Human Services? And my second question is about testing, which I think that Harvard had an analysis that suggested that we need 1,100 tests a day. You indicated a goal of 1,500 tests a day. How are we doing with that? And yeah, so contact tracing and testing.
Sure. So, and again, I'll let Dr. Chan jump in here at any moment, but I'll say that we are, just to be a little bit repetitive, we're one of the states that have always maintained very strong contact tracing ability. We're always bringing new employees on and new staff on to maintain doing that. We've actually taken over the entire downstairs of a conference hall in Concord to, again, just expand the ability for folks to get on the phones, contact people. It's been a very powerful tool for New Hampshire that we never gave up on, and I think has put us in a kind of a lead position given our proximity to the outbreak in Boston. So no, we'll keep contact tracing up as robust as we can and as robust as we need to, whether it's with employees in the state, which we're doing with now, or we could always bring in outside sources if we really had to do it. So we leave all options on the table, and it's something we definitely won't be turning over. Oh, absolutely. Yeah, we could increase if we had to. Sorry, the second half of the question was... Testing, yeah. So I think yesterday we did, looks like just over 1,200 tests. And so we anticipate to maintain that average, if not increase it to the 1,500, which was over and above what the Harvard study said that we needed as a base. Look, I guess I don't look at what we need. You know, someone can say what we need, and I want to go higher, right? I always want to test more. I always want to get more information. That's always a very powerful thing, so we can keep going back and making sure whatever we're doing is based on data, not just public push or political will or any of that stuff. It's really data and science driven in terms of, and having more testing availability will allow us to do that.
You're going to be heading out and going to a place to eat outside, go to a
Go out to eat. You think I have time to go out to eat? What do you? I'm not. Well, I haven't really thought about it. No, I mean, not tonight. No, I haven't really thought about it. Yeah.
You're confident. I mean, you were saying these places can open.
Oh, sure. No. Oh, yeah. No. Oh, yeah. Yeah. Would I? Oh, of course. Oh, absolutely. No, I look forward to the opportunity of doing it. Maybe on the, in a couple of weeks with my kids. Again, it's not going to, the outdoor, it will still be in a takeout mode until May 18th. So we still have a couple weeks there to be clear about it. And again, we have the ability to flex one way or the other if we have to. But no, I think it's a great opportunity to kind of make motions to start moving forward and start building towards the summer and kind of those heightened months, and see what the data brings. Until then, I'll be on takeout or whatever. I'm not eating healthy lately. I find it's a little.
You don't look like you're wasted on that.
Yeah, the COVID-19, as they call it, right? The COVID diet, yeah. Well, look, we thank everybody. I appreciate it's been a very long presentation today. These are huge steps that the state is taking. We appreciate that. But we want to, again, let people involved into our thinking, where the data is, why we're doing certain things, allow to ask questions, allow that public process within the task force, the Reopen New Hampshire Task Force, to continue. And I think by getting some feedback over time, we're going to keep making it a better and better process so we can take steps forward. And hopefully they're all steps forward. Hopefully we don't have to take steps back. We can if we have to, but I think everybody wants us to continue to take steps forward in a careful and thoughtful way, with science and data behind us, with public health behind us, and always knowing that this viral epidemic has to be the preeminent variable in our decision-making process. So we thank everybody for joining us today for the extended presentation. We want everyone to be safe and have a great weekend. Thank you, guys.
So there you go, Governor Sununu with a rather long presentation today. A lot to unpack here, what he's calling amended stay-at-home orders that will go to May the 31st. Let's take a look at the timeline now. There is a number of things that's going to happen over the course of the month of May. Immediately, campgrounds, manufacturing, and interior parks will be able to be open. The seacoast beaches will remain closed. May 4th, hospitals will be able to begin some of those elective procedures. Universal business guidances will be in place for manufacturing. And then beginning on May 11th, golf courses will be able to open, of course, with distancing in place, limited food services, retail services will be allowed with about 50% occupancy in some cases. Drive-in theaters will be allowed to open. Barber and hair salons will be able to open beginning May 11th. Both the barber or the stylist will have to be wearing a mask as well as the patron. That will be done under a heavy reservation system. That's for barber and hair salons. And then on May 18th, limited outdoor dining will be allowed in our restaurants across New Hampshire. Takeout is still underway right now, but the outdoor dining restrictions will be put in place beginning on May the 18th. We'll unpack a lot of this for you, beginning with News 9 at 5:30 today, when the governor will be joining us for your questions. Now, here's the basic health rundown as of now. 81 total deaths, 9 new deaths today. These are all within nursing homes and elderly care centers across the state. There were no deaths that occurred outside of those jurisdictions, for a total now of 2,310 total cases across the state. We had 165 new cases today, but again, in large part to the additional testing that's now underway. And we have a total of 270 total hospitalized cases. At least 980 people have recovered from the coronavirus. There is an awful lot to go over. We have crews covering this news conference that just occurred. We'll have in-depth coverage for you beginning in just 35 minutes from now, beginning with News 9 at 5. And then again, we will be joined live on the air here with the governor beginning at 5:30 tonight. We hope you'll join us then and stay with us for all the latest information throughout the day and night. We return to our program.